Anencephaly is a cephalic disorder that results from a neural tube defect that occurs when the rostral end of a neural tube fails to close, usually between the 23rd and 26th day following conception. Children born with this disorder usually live mere hours after birth. The remaining structure of their brain is usually covered only by a thin layer of membrane, skin, bone, and meninges. When babies are born with anencephaly, they're not expected to live past a few days, and they sometimes die after only a couple of hours. The cause of anencephaly is largely unknown and disputed, but recently, scientists have come to believe that folic acid plays a key role in whether or not a baby will have anencephaly. Very recently, studies have shown that anencephaly can also be genetically related. Unfortunately, there is no cure for anencephaly, so all treatments administered to the infants are done so with the intention of making them as comfortable as possible, as opposed to prolonging their life for a significant period of time.
A great example of the ethical debate that cases like these cause is the story of Baby K. Baby K, otherwise known as Stephanie Keene, was an anencephalic baby born in Fairfax, Virginia. She was missing most of her brain and remained on a ventilator for 6 weeks, and her doctors strongly advised that she be placed on Do Not Resuscitate, but her mother refused, citing her devotion to Christianity to preserve all human life. Her mother finally agreed to move her to a nursing home, which would use less resources to keep her alive. Thanks to her anencephaly, she had to come back to the hospital numerous times for various complications. A court ruled that Fairfax Hospital, which hosted Baby K, appealed to the U.S. District Court for the Eastern District of Virginia, and they ruled in favor of the mom. They referred to the Emergency Medical Treatment and Active Labor Act, or the EMTALA, which basically decrees that anyone, including illegal immigrants, criminals, and those unable to pay for it, must be given emergency medical attention to the point that their condition is considered stable. Interestingly, the EMTALA isn't actually covered by the federal government, which means that the hospital needs to pay for it out of its own pocket, which leads us to a very important facet of the arguments against keeping Baby K alive, being that doing so is simply a waste of hospital resources, as the equipment being used to keep her alive could have been used on other people, which prompts a discussion of whether some lives are more valuable than others.
From a person looking from an autonomy perspective, taking the organs of babies with anencephaly would be considered unethical, as the doctors or the hospital would have no right to make the decision for the family. Because the family would probably want the baby to be kept alive for as long as possible, this would mean that the hospitals would have to devote their precious resources to keeping the baby alive. The hospital would also be required to provide as much care as possible for the baby with anencephaly, because they would have no right to play God and end the baby's life. From an autonomy perspective, the mom of Baby K would be in the right as she tried to preserve her child's life for as long as possible. But this once again raises the question, are some lives worth more than others? Because the organs of babies with anencephaly could save someone who needs a specific organ, even though the parents are in the right, are they being ethical? This perspective allows us to realize that just because something's considered legal, it does not mean that it's necessarily ethical, especially if there's an immediate need of a certain organ, which the baby could provide. Furthermore, a question that Ziad and I came across basically posed the following. In taking an anencephalic baby off life support, aren't we as humans directly ending a life? This reminds us of the trolley problem that Miss Sam posed on our first day of bioethics. Does one do nothing in the name of carrying out one's duty, thereby absolving them of personal guilt? Or does one make the choice to act for the greater good? Those arguing from an autonomous ethical standpoint would say that making the conscious decision to end a life in favor of sparing many would be downright wrong.
The good of the many outweigh the good of the few. This is the unofficial creed for those who view ethics from a beneficent standpoint. For them, it'd be considered ethical for the hospitals to take babies born with anencephaly and donate their organs. They'd be in the right for doing this because they'd be sacrificing one life that could not really have been lived for up to a couple lives to be extended. Babies with anencephaly are expected to either die before birth or only a few days after. And even in extreme cases, just like we saw with Baby K, the baby only lives 2 years, which could be outweighed by someone living 20 more years, or 30 or 40. Having the babies donate their organs would also make sense from a standpoint that hospitals would not have to spend a couple days using their resources on taking care of a baby that's doomed to die. This references the EMTALA, as from a beneficent standpoint, the hospital should not be required to spend their resources on a baby who will never be considered stable, but who might die within a couple days pretty much no matter what the doctors who are forced to take care of the baby do. This prompts the discussion as to whether certain lives are more important than others, and even more polarizing, do we have the right to make a choice regarding the life of another human being? This question is prevalent not only so-called pull-the-plug cases, but in conversations about abortion and the death penalty. One of the biggest problems that hospitals face is overcrowding, especially in emergency rooms. This problem is exacerbated by cases like this, where the hospital in question has a legal obligation to give emergency attention to those who need it, and unfortunately, that creates all sorts of problems for those who'd argue that it's all about the quality of one's life, not the quantity. Now, whether we have the right to determine the quality of one's life may be a controversial topic. It's hard to be so cynical as to reduce one's life to a set of numbers, points on a table, checks and boxes. But if we fail to acknowledge that some way, some objective way of deciding who lives and who dies exists, then we're basically doomed to have this debate forever, finding no solution. Jacob M. Appel, a bioethicist and medical historian, wrote something that I think is very fitting for a beneficent standpoint. He said, "As physicians, we're in the business of saving lives, not pandering to ideologies." This references more to Baby K's mother's argument, which was heavily made up of religious reasoning, but it's still applicable to the overall autonomous line of thinking. As far as the biology side of this goes, anencephaly is a birth defect where a baby is born without most of their brain and skull. For normal babies, a tube in the brain called the neural tube forms during pregnancy and helps put together the spinal cord, a couple vertebrae, and the skull, connecting the back of the skull and the brain. Anencephalic babies suffer from that neural tube not closing all the way, and that causes birth without the forebrain or the cerebrum. According to the CDC, about 3 in every 10,000 babies are born with anencephaly, and the Cleveland Clinic says that the recurrence rate is 4 to 5%. It can be diagnosed by fetal MRIs, blood tests, ultrasounds, or amniocentesis, where a small amount of fluid is withdrawn from the amniotic sac using a long needle that's inserted through the abdomen, and the fluid can be analyzed to measure the levels of alpha-fetoprotein and acetylcholinesterase. If there's high levels of those, chances are the fetal has a neural tube defect. About 7% die during the pregnancy, 20% die during delivery, and 50% have a life expectancy between a few minutes and 1 day, and about 23% live more than 1 day. In very, very few cases, the child can live for weeks or even months on end, as we saw with Baby K. As with controversial issues like this, it's important to remember that there's multiple viewpoints on every facet of arguments. So going forward, be mindful of other perspectives and always argue for what you believe in. Thanks for watching.